Hello and welcome everybody. I hope we've got plenty of people joining us on the call today, and thank you for giving up your lunch break to come and listen to us. We really felt very strongly about putting a webinar on today that's around mental health leadership in paediatrics, and I do hope that we're going to convince you of the importance of that throughout the next hour, but I'm hoping that those who've chosen to join us today are already thinking along these lines. So before I introduce myself properly and sort of begin it, I just wanted to say that the event is being recorded and I hope everybody's okay with that. That's so that those who haven't been able to join us can get the recording at a later date. I'm very pleased to be joined by Emma and James, who will both introduce themselves later in their sections to let you know who they are. And then finally, just to say that we really hope we're only intending to talk for the first part of this, because what we really wanted was some active discussion and debate and conversation between all the attendees. So please do keep posting your any questions in the question and answer on the right hand side in the text box, and we'll pick up as many as we can to go through today. But we're really keen to just hear comments, feedback, generally to take forward. So thanks again for joining us, and if we could move to the next slide, please. So for those of you who don't know me, I'm Karen Street. I was an acute general paediatrician down in the southwest. I've moved on to different things in the last year or two, and one of the roles I have is now the RCPCH Officer for Mental Health. If we could just move to the next slide. Now, I very deliberately brought this back up again because possibly it was on the top left-hand corner of the first slide and people didn't really notice, but I really just wanted to emphasise exactly what RCPCH say in our logo. We say that we're leading the way in children's health, and I just want you to hold on to that word health, because we haven't specified at any point whether that's physical health or mental health or any other health. And if we could move on to the next slide, please. So let's think about children's health. We all think of ourselves involved with the physical well-being of children, but we need to also think about mental health, mental illness, emotional health, behavioural and neurodevelopmental presentations, because that's all part and part of what paediatrics is and should be. I just wanted to sort of share some of these statistics with you. This is pre-COVID, a lot of these, and as we all know, the COVID pandemic has brought this to the fore and increased the problem in many situations. But there's now 1 in 6 of all 5 to 19-year-olds in England have got a mental health problem of some sort. 75% of children and young people who've got a mental health problem also have a physical health or a developmental problem. Having any physical complaint, so all of our caseload, having any physical complaint compared with no physical health condition increases the odds of having a mental disorder by 82%. 50% of all mental health problems are established by the age of 14 and 75% by the age of 24. Suicide is now the leading cause of death for both males and females across England and Wales, and in Northern Ireland they have significantly higher figures than we do. And then finally, the risk of developing an eating disorder is highest in males and females between 13 and 17 years. And anorexia nervosa is the highest mortality of any other psychiatric disorder in the age population that we see. So I'm sort of hoping that as those figures sink into people's minds, we're hopefully all on the same page of appreciating that actually if we're talking about children's health, their mental health is a very, very significant part of that. Next slide, please. We tried to really embrace this in the Royal College position statement, which was one of the first things that I was involved in this role, and it's published in September 2020 and it's available on the college website. But the really sort of key message of that is that the mental health of our patients is our business. And next slide, please. So for those of you, hopefully some people have read the position statement on role of paediatricians in children's mental health, but if you haven't, these were just the few key messages that were pulled out at the beginning of the section on their website. And that is that one of our recommendations from back in 2020 was that all paediatric teams should have a nominated lead for mental health. There's a bit more there about training and support that might be needed, and a little bit about working together with others, and that's going to be covered hopefully in when James and Emma both speak. Next slide, please. But we're not the only ones who've been calling for leadership in mental health. In fact, it was a recommendation from the NCPOD document around the mental health care of young people and young adults in acute hospitals back in 2019, when they found that the mental health care fell woefully short of the physical health care offered in acute hospitals, and they suggested a recommendation of having a lead for children and young people's mental health in acute hospitals. There's also, again, for those of you who may or may not have seen it, there was a joint college statement, and I know people sometimes think, oh yeah, statements are just words, but it's amazing actually how much you can then hinge on powerful statements that are made, particularly when they're cross colleges and cross organisations. So please do read this joint college statement published in December 2021 between RCPCH, RCPCH and the Royal College of Emergency Medicine. Again, making it very, very clear that we need to work together for children and young people's mental health, and you know that it's all of our business. We can't let them fall through gaps, and calling for leadership in all of these areas around mental health. And then finally, what I wanted to tell you just a little bit more about is a recent publication, and that is around a framework for support for children and young people with mental health problems in acute settings. And this is a stream of work that was done through the NHS England Children and Young People's Transformation Team alongside the Children and Young People's Mental Health Team. So could we go to the next slide, please? So this really arose as a sort of task and finish group that the RCPCH have been represented on, or we've been representing RCPCH on this task and finish group, led by NHS England, the two work streams there, all around how can paediatricians be better supported in acute settings to deliver services that are appropriate for children and young people's mental health. And I've lifted just a couple of their slides now just to sort of share some of that work with you, because it was an ongoing piece of work for about 6 months, from last summer really through to the very start of this year. And it's now gone live in terms of NHS England on their website as a framework that's now gone out to regional teams to be put into action. So essentially, as you said there, the aim of their work was to ensure that our paediatric workforce is supported when caring for children and young people presenting to acute settings. And they reference there particularly eating disorders and crisis presentations, that the paediatric workforce understands where to get additional support if we need it, but also that we're working within a wider multidisciplinary team and wider systems in terms of offering support for these children and young people, and we're not feeling like we're working in isolation. So it felt like a really positive sort of 6-month piece of work, actually, in terms of really recognising the stress that we're all under on acute paediatric wards in trying to manage this. Escalated because of the pandemic, but by no means was it absent beforehand. And next slide, please. So for those of you who this might be the first you've heard of this framework, there's a sort of a slide set, and there's also all these details actually on the NHS website. It explains a little bit at the top there about this task and finish process and having representation across the board. And I'm really pleased that they did listen to us and agreed to put in that middle section, in addition, following recommendations from RCPCH and NCPOD, this idea of having a mental health lead role with designated time within a paediatric unit to champion change in the paediatric workforce. Because as you'll see, they've given those 4 examples, and these were just sort of recommendations that came from that working group of things that could be changed to or could be set up, innovations that could really help in terms of supporting acute settings. Next slide, please. And we were asked to briefly describe what that role might be, just as an example when this is going out to the regional teams. So we felt that this is somebody who might have approximately a PA per week in their job plan, but we weren't prescriptive about that. Any senior clinician who admits to a paediatric ward or holds clinical responsibility for paediatric inpatients or outpatients. But the key functions to start with, these aren't people that need loads of extra training. These are just people that will step forward to build team confidence and morale, which we know is really, really low with some of the experiences over the last year or two, to really encourage uptake of training that includes mental health competencies and skills, to facilitate joint working across physical and mental health trusts, so reaching out to CAMHS colleagues and where there aren't already good forged relationships to establish those, and really just to provide leadership both within the department but also at strategic level through the sort of trust structures. So this was our vision for what we thought a mental health lead role might be. And sorry, you preempted me there. I went to the next slide, but yes, please. So really, I just wanted to finish my little bit by saying, hopefully we're going to have some really helpful discussion today. We're going to hear a bit from Emma, who's got more specialist role within this area, and James, who was a newcomer to it but has done great things down in the southwest. But to all of you who are listening here, what I would say is, in terms of leadership in mental health, it's something we do need to do because we are about children's health, and this is the biggest area of health need at the moment. So push yourselves forward, whether that's in your department, whether it's across your trust, or whether it's approaching your CCG or ICS. Network both locally, regionally and nationally, and from this and from a number of other things that we're running, we're looking with the college at ways in which we can support a network either through ourselves or through the PMHA, which Emma's about to tell us about too. Share ideas and experience and development, because none of us know exactly how to do this right. We're all learning on the job by and large until we've trained up a bigger number of people. So just share and that's where a network will really help to be sort of learning from each other's experience. There is a bit of a work stream going on in the college at the moment around workforce development and what do paediatricians look like in 2040. And I think that's a really interesting question. I think there's a lot of work to do there, because there's no doubt the work paediatricians will be doing in another 10 years is going to look very different to what it did sort of 20 years ago when a lot of us, were first working. And finally, just to finish, to say, please reach out to CAMHS colleagues. That's the biggest thing that I've ever learned. They are another group. When I say Royal College of Psychiatrists, within the Royal College of Psychiatrists, they have their child and adolescent faculty, and they are entirely dedicated to children and young people's mental health. So it 100% makes sense that we should be working really, really closely alongside them. So as we switch from speaker to speaker, I just wondered if we could just put up my last slide just to put that in everybody's minds. But I'd like to hand over now to Emma, if that's okay, and Emma can introduce herself, and we'll hear from Emma about what's available for those who want to do more in the area of mental health.
Thanks, Karen. I first of all would like to thank Karen for all the work that she's doing nationally to advocate for young people's mental health and really put it on the agenda. My name's Emma Blake. I'm a child mental health paediatrician and I chair the Child Mental Health CSAC, which is the training committee for the Royal College of Paediatrics and Child Health. And I'm also the convener of the Paediatric Mental Health Association. And if you don't really know what that is, then I will introduce it, but get joining later today and become part of the team. And I've put my email address there if anyone would like any further discussion later on. So next slide. So we're just going to talk today about how you might get some more child mental health experience and support if it's something that you're interested in, or if you take on the lead paediatrician for mental health in your department. We're not saying that you have to have a specific qualification to do this role, but it might be something that you're interested in developing further, and perhaps in the future it might be something that's more attached to the role going forward. So within the Royal College of Paediatrics, we've got, as part of the CSAC, we have grid training and spin training, which I'll talk a little bit about. There's also the Paediatric Mental Health Association, which is a special interest group that's affiliated to the Royal College, and it is mainly paediatricians with an interest in mental health, but also has psychiatrists, psychologists, social workers, nurses, teachers belonging to it. So it's a multidisciplinary group. And then the Paediatric Mental Health Association is working with the Royal College to try and develop a national network of paediatric mental health leads. What we actually call that at the end of the day, I'm not sure yet, but that's something that we're working on, so that when people get in post for the paediatric mental health leads, we can have a national support network, which I think similar to what they have in safeguarding, which is very useful for peer support and improving standards. So next slide. So with regard to SPIN, so SPIN is a special interest module, and there is a SPIN in mental health, which is quite new. It was started in, I think, it went live in November 2020, and we've been developing it for quite some time. So it's basically the same setup as all the other SPINs through the Royal College. It's the 1 year whole time equivalent training, can be done part-time over up to 3 years, but can actually do it over 5 years if you have maternity leave or sickness leave or something like that, so you can do it over 5 years. But it's the equivalent of 1 year whole time equivalent, and we're not trying to cover the whole of mental health in that time. It can be quite specific. So for example, if you were taking on the paediatric lead for eating disorders, for example, you might want to do your SPIN in specifically around eating disorders and other skills that would relate to that. So it could be quite specific, for example, so eating disorders, or you might think about doing sort of neurodevelopment and mental health, or mental health and safeguarding. It could be, you could kind of just design it according to your local needs. So I've put the link in on the slide there. I think that, so this is being recorded, and we can put the links in the chat as well. So next slide. So these are some ideas of what a SPIN might be useful for. So for example, local lead for paediatric mental health, a lead for paediatric disturbance on acute paediatric wards. And I know that this is something that's causing quite a lot of stress for acute paediatricians around the country, and is a significant part of our workload at the moment. Being involved in setting up reflective practice, such as Schwartz rounds and support for staff as well as young people. Lead paediatrician in eating disorders, paediatrician in complex teams, and I know there's lots of different models for complex teams around the country, for example in medically unexplained symptoms, chronic fatigue, complex pain. Mental health has a huge overlap with neurodevelopment, as Karen indicated earlier, and so it would be very important if you're going to specialise in neurodevelopment to have further expertise in mental health. And again, as Karen gave us some statistics for earlier, mental health difficulties with children with long-term health problems, physical health problems, is very significant. Also, the number of children presenting with a primarily psychological problem within neurology, rheumatology, gastro, emergency medicine, it's very high numbers. So it's also very important for designated or named doctors for safeguarding. I'm the designated doctor for safeguarding in the area we have, and there's a huge amount of mental health work in that role. And also obviously in looked after children, adoption and fostering. And there's a big move now towards trauma-informed paediatrics, particularly looking at adverse childhood events, which impact on not only mental health, but physical health. Next slide. So grid training is again, has oversight from the CSAC. This is 3 years of whole-time equivalent training and will lead to being on the GMC register as a subspecialist paediatrician in child mental health, and that's the training that I've done. So this, if you get a SPIN, you're not a subspecialist, but you're a general paediatrician with a special interest in mental health, whereas grid training, you'd be a child mental health paediatrician. I just want to be clear, it's not a different route to becoming a child psychiatrist, and a child psychiatrist is a different role. Obviously, there's overlap between training and patients, but it's not it's a paediatrician with specialism in mental health rather than a child psychiatrist. Next slide. So the Paediatric Mental Health Association has been going for, I think, something like 35 to 40 years. It's a long-running special interest group, and it's really becoming very vibrant. Well, I think it's been vibrant for a long time, but there's a lot of very passionate people involved in it, and they're a very good network of anyone who's interested in mental health to join. We have our annual meeting, which used to be called Highgate, because that's where we did it in a hotel called Highgate in January, but that hotel went bust in COVID, so I'm not quite sure where we're going to be having it in the future, but it's usually in January and 2 days, and it's a very useful meeting. There's also a summer meeting coming up, which I think is the 7th of July, and we're going to be talking about a similar topic to what we've discussed then. So if you've been interested in today and you want some more information, then come to the PMHA summer meeting in July. We've got we're part of the Royal College annual conference this year. We're doing our session on the 30th of June about suicide, about risk assessment, about how to support families if there's been suicide, and how to support staff, and also the voice of some young people and parents who have experienced suicide. The Paediatric Mental Health Association have been running a webinar series for about a year. We've been doing it every 2 weeks, and it's going to be moved to every month, and that's been linking in with other special interest groups, and as a resource that you can still access. They're all been filmed, and you can access them, and we're linking in with Health Education England to put it onto their website as well. We also do some work in national policy advocacy, working closely with the Royal College, and lots of other things. So if you're interested in joining, you'd be most welcome, and I've put the link up there. Next slide. So the National Network of Paediatric Mental Health Leads, this hasn't started yet, it's kind of a work in progress, and it's going, and we're working closely with the Royal College and the PMHA to get this established. So if you're interested and want to get involved, then please let Karen and I know, and we can start setting this up. That's it really. So thank you very much for attending today, and then I'll be part of the panel discussion at the end. Thank you.
That's brilliant. Thank you, Emma. That's really, really helpful. I'd just like to move straight on because we're already getting loads of questions coming through, which will be great to cover for the sort of second half of this session. But we really wanted to hear from James, who I know locally in the Southwest as somebody who, when he was training, didn't imagine him to be in this role, but here he is a year into being a consultant, and he's going to tell you how he's quite brilliantly become a lead in paediatric mental health. So James.
Thank you very much, Karen, for that kind introduction. I'm not entirely sure it's all true. My name's James Din. I'm a general paediatrician, and I've got a spin and a subspecial interest in high dependency care paediatrics. And I CCT'd about 13 months ago. I don't have any qualifications in paediatric mental health, eating disorders, adolescent medicine, or transitional medicine whatsoever, and as a result feel woefully underqualified to follow Karen and Emma, who are obviously leaders in their field. But I suspect part of that is one of the reasons that Karen's asked me to speak today, because part of this role is that you don't need to be a specialist in mental health in order to lead and advocate and be passionate and enthusiastic about this often quite marginalised patient group. Next slide, please. That was just to represent how out of my depth I sometimes feel in this new role. I wanted to tell you a little bit about Torbay, if we could go to the next slide. So those of you who don't know the English Riviera, it's a very nice place to come, particularly at this time of year and into the summer. But actually, if you scratch beneath the surface, you reveal a whole host of problems. We have some of the worst socioeconomic indices in the entire of the UK in the Bay Area. And with that comes high levels of domestic violence, substance misuse, and adults' mental health disorders, and that's built on a background of multi-generational neglect, abuse, and trauma. And subsequently, we see a huge number of children who are looked after children, and a large number of children who have special educational needs, well above the national average. And with that comes a huge burden on our paediatric mental health services locally. So if we could go on to the next slide, please. I was asked to take on... Ooh, thanks, Zara, that's fine. We'll go with that. I was asked to take on the mental health lead role about 10 months ago by our clinical service lead. This was partly recognition of the fact that there's a really dire need in our locality for this, but also a recognition of that the college has been really pushing that there should be representation amongst the consultant body for this group of patients. And it essentially absorbed the additional PA that I have as a new consultant, and that's where we found the time for it. And because of the work that I've done, it has been carried on into my second year as a consultant, and I hope it will continue. But essentially, the first thing that I needed to do, due to my lack of experience, was sit down and ask for help. So I reached out to our local CAMS team, and I reached out to the multidisciplinary team that we have here, and we wound up managing to get together in a room back in June 2021 and setting out some aspirations for what we want for the service. And it comes back to the parity of esteem that Karen was talking about in her slides, that actually we are really passionate and want to see a service that cares for and gives equal gravitas and compassion to children presenting with mental health complaints as we do for the children who present with physical health complaints. And we identified sort of 6 areas that we really needed to be working on to try and make this a reality. If we could go on to the next slide, please. And part of that was me asking for lots more help. And really, the really important thing was to go to the experts, and these were the young people. So we were very fortunate in the fact that we managed to make contact with our CAMS's focus group, which is made up of young people who are either currently under CAMS or have previously been under CAMS. And we've involved them from the very start in developing our policies and guidelines, involved them in service development and procurement, and involved them in our regional network, which has sort of sprung up out of this. And actually, we had 2 young people who opened our recent network meeting in February. As well as this, we've linked in with our local CAMS team and really started to build bridges and communication with them, and working towards a sort of a partnership with them. And that has been quite difficult because we've built on some historic, quite bad blood between the teams. But the CAMS team have been brilliant and actually sort of extended the hand out to us initially, and then we've responded to that. So a lot of the work that I've been doing has been trying to demystify how they work, and vice versa. But they know now that they've got a contact and a friend within the paediatrician camp who they can come to and open discussions and speak to if they need to. I've also been very fortunate in my training in the Southwest that I've worked with some really inspirational people such as Karen, amongst many others, and it made a lot of sense for me to approach them and ask their advice about how they've approached the problem of paediatric mental health and the challenges that they've encountered. And it's always been a natural next step that we've subsequently linked up with members in each trust across the Southwest footprint from Taunton westwards, really. We've now got a link person in each of those sites, and a whole host of interested parties. And my real reflection on that was that actually there's some amazing work going on, but it's often siloed, it's often unsupported, and it's often being done in isolation by people who are really passionate about improving mental health, but doing it in a very unlinked fashion. And out of that, this the Southwest Paediatric Mental Health Network has sort of been born, which is basically us clinicians trying to share the load, but also trying to share good practice, learn from each other, learn from previous failures, and trying avoiding those where we're working. And actually, it's been a real success. And we had our first face-to-face network meeting last month, which was attended by over 40 people, and Karen very kindly spoke on. And we also had a big online attendance to that as well. I've put a little pound sign by that because that's the first thing that actually cost any money out of all of those things. Next slide, please. So the next thing that we really wanted to focus on was our acute inpatient management, and I think that this is where a lot of the staff burden lies, and tied into that is the sort of education and training and support for our staff, particularly our nursing staff, who are often the frontline staff dealing with some of these very complicated and often challenging cases. And some of the things that we've done, I've put up there. So we've agreed some common resources that both us and CAMS are promoting for young people and their parents to use. There's a whole wealth of apps and websites and all sorts of stuff out there on the internet, and you can almost get overwhelmed with the information. And so we have selected and nominated a select few of them, and those are the ones that we're going to be promoting as a department along with CAMS, so that it's not too confusing. You can wade through the morass, and these are the ones that we think will actually really help. We've also managed to leap on the end of a last-minute bid for children's mental health, and got 15 grand's worth of equipment to improve our ward environment, to make it a more friendly place for neurodiverse children, but also those who are experiencing mental health crisis. And as part of the network, we shared our bid with one of the other departments in the region, and they've also managed to get 15 grand for their ward. So that's been a really good outcome from the network already. And we're just working very closely now with CAMHS to try and improve the acute patient journey. In terms of the education and training, this is very much a work in progress, but we're in the process of designing a training package for our staff. We want to designate some mental health champions who have been through this training package, and really make it a mark of pride. But ultimately, you know, we want all of our staff to have been trained in suicide awareness and prevention. We want all of them to have basic mental health training about approaching those conversations with young people. The eating disorder team have set up monthly meetings with our ward staff to support them as they're dealing with often complicated long stay patients who are going beyond the 3-week stay admission. Some of them have been under the Mental Health Act, some of them have been needing daily or multiple times a day restraint for NG feeds, and I know that that's not a unique situation across the UK in the recent months, but the ward staff have really appreciated the support from the eating disorder team specifically for them to debrief and talk about these cases. We're working with our security teams about de-escalation training and linking that into how we can try and reduce the incidents that we're needing restraint by actually de-escalating situations before they reach that point. And we're looking at collaborative training days with the CAMHS team, the first of which was the network meeting last month. Next slide, please. I'm going to whiz through this one. So governance and community work is the area that has been most neglected of the 6, but again, we're working to revise our guidelines, which are often being born out of an atmosphere of fear and sometimes panic about certain situations that we've faced on the ward. But we're looking to make use of the CAMHS focus group to help us make those guidelines that work for the young people and for us. And we have now set up monthly CAMHS meetings so that we can bring acute cases and discuss them with the CAMHS team and the paediatric consultant body. Finally, in terms of our outpatient and community work, this is the area where we still have so much work to do, and I'm very conscious not to neglect them. One of the very simple things that we've done is we've put in a mental health resources leaflet, which we can now send out with our outpatient letters to essentially all young people, but particularly if they're presenting with functional symptoms, headaches, or overt anxiety or low mood. We're trying to link in with some of the third parties and charities in the locality. I've had mixed success with that so far, but hoping that it's going to pick up. And there's a lot of work to be done with chronic conditions and approaching all the other people who are involved in the sort of edu-psychosocial triangle, and try and see how we can better support each other. Next slide. So I thought I'd just outline some of the successes that we've had, and some of the challenges that we've faced. So I've been very fortunate in that I've had great support from my department, from the region, and from so many of my colleagues in CAMHS locally and in the department, from nursing staff and the rest of the MDT. And I know that's not the same everywhere. So I've been very fortunate in that. One of the things I have found is that there is so much low-hanging fruit here. It's a really rewarding thing to get involved in, because there's some really basic little changes that can make a huge amount of difference, both to the teams that you're working with, but most importantly to the children and young people and their carers. There's also a real appetite for change. It's almost a thirst for somebody to just take the reins and start leading people in a direction, and it's these isolated pockets of people who are really trying hard to make little changes in their areas, and it's about linking them up, encouraging them, supporting them, and actually driving towards a bigger goal. And that's been easy to do because there is this appetite for change. People know about it, and that's the inspirational work that's already there to learn from. And also, it's really exciting times to be involved in paediatric mental health, because the pandemic has been both the worst and the best thing that could have happened to children's mental health. It has compressed a trend that we've seen over the last 10 to 15 years of increasing pressure on mental health services. It's brought it to the attention of the public. It's brought it to the attention of Westminster. There is money coming down. And actually, it's a great time to jump on the bandwagon and make a big noise about this, because we've got the public's ear and the public's sympathy at the moment. So it's an exciting time to be involved. That said, culture change is incredibly hard. There's no two ways about that. I've inherited quite a poor working relationship between CAMHS and Acute, and almost shockingly encountered CAMHS consultants and CAMHS teams who are quite afraid about approaching paediatric teams because of the sort of vitriolic and almost angry responses that they've had in the past, and trying to get over some of those barriers has been quite challenging, particularly within my department itself. CAMHS operates under a slightly mystifying system, which has taken me quite a while to get my head around. The fact that the senior decision maker quite often isn't the CAMHS consultant. I think that's probably one of the biggest realizations that I've had. But also trying to sort of work out where funding comes from, who's responsible for what, has been quite mystifying as well, and that can be quite a challenge, unpicking all of that. I've got a PA to do this within my nominal job plan. It's simply not enough time, and that's because as I immerse myself more and more in this, the scope of the problem begins to reveal itself, and there is still so much to do. But actually, there's a lot of great work that we can do for these children. Next slide. And that's it. Really whistle-stop tour, to hopefully give you an idea of what you can do without any particular training or knowledge about paediatric mental health, that it is possible. So thank you very much for listening.
Brilliant. Thank you, James. And I knew that you were definitely the right person to speak, because, you know, he's been a perfect example of how it just needs to be somebody who's got the leadership skills, the passion, you know, the energy, and the great graphics for really producing major change across the Southwest when a few of us had got a little bit jaded from it all. So thank you very much, James. So we've had loads of questions coming through, and we're trying to filter them into a conversation that hopefully will be helpful to everybody. We've got about sort of 15 minutes to go through some. So we've got a question one here, which I think probably I'll just answer quickly myself, which is, what's your advice on getting commissioners to buy into the idea of a mental health lead role in paediatrics? So this to me has been my journey in my career, because I felt like I was bashing my head against a brick wall and got as far as I could being an on-the-ground paediatrician. And some of the decisions that I made in my career 2 or 3 years ago has now flipped me to the other end, where, and I think I made reference in my talk to it, it looks like it's just a load of words on paper. But actually, when you can come out with joint statements, when you can get things on paper from NHS England, I think that's what you need to go to your commissioners with. You need to go and be really clear that you're passionate about it. You can bring X, Y, and Z to this role, and look at all these places where it's highly, you know, it's recommended. So reference the joint statements, reference the Royal College position statement, reference now what's in black and white from NHS England, and just go with that, and just keep knocking, because we all know that they can see different priorities at different times, but just keep knocking on those doors. Question 2 is, what's your advice for junior members of staff on breaking down the stigma around mental health within a department? So my first bit will be change the language. That's the CAMHS patient would be my biggest message. But I'm going to go across to Emma otherwise to see what, Emma, you would say to that.
So I think younger people coming through now and talk about, you know, our children and young people and coming up into trainees have got a slightly different generational outlook, I think, on mental health than some of us older people do, and I think that's healthy, and there is less stigma, and I think it's about, you know, normalizing mental health as you know, that we all have mental health and that it's becoming less of a stigma to talk about, and seen as parity with physical health. The Paediatric Mental Health Association has a really strong trainee group that run our webinar sessions, and if any trainees are interested in joining that trainee group, they'd be most welcome, and there'll be a network of trainees around the country with an interest in mental health that are really doing some innovative national work on that. So I'd say keep persevering, keep trying to break down stigma barriers in your department, link in with your local CAMHS team, with psychologists, psychiatrists, and I think, you know, do some more joint working, and that would help break down the stigma.
Yeah, brilliant. Thank you, Emma. We've got another question. What are your thoughts on the relationship between mental health lead roles and eating disorder services? So I'll go to James in a moment because I know where you are. You've got separate eating disorder roles. I mean, I think for me, the important thing about separating these in your mind is not about what the person does and whether it's the same person or a different person, but it's where potential funding for this is. I would be really pushing people to say that, you know, the access and waiting time standards that came out in 2016, the commissioning guide to that was that eating disorder paediatric time should be commissioned as part of eating disorder pathway. So it's a clinical role within an eating disorder pathway for which there should have been funding in from 2016. This newer role that we're talking about that will have some funding in some areas coming up is different, but I don't know what you would say. And we've said this at the moment, we would see this role as being just somebody like James, somebody with that leadership, that passion, and that willingness to take it on. And with time, it might develop into someone with more skills. But James, what would you say to that?
Yeah, I'm inclined to agree. I think eating disorders have the obvious overlap, don't they? And I can think of a good example in Anna Kyle in Taunton, who does an absolutely sensational job of juggling both the paediatric mental health liaison role with CAMHS about general paediatric mental health, but also deals with is also the eating disorder lead. But she's got 3.5 PAs to do all of that. So I think that the concept that you can jam it all into one PA, or a PA for that and a PA for DCC, that doesn't gel with me. Just the pure scope and the amount of time that this takes, you can't do it and juggle the eating disorder service, particularly as it is at the moment. So I would try and distinguish between those roles if you can at all. And I would certainly be saying to your department, I need additional PAs if you want me to take on the responsibility of being the mental health lead for that department. In Torbay, we have separate, so we have 2 eating disorder consultants and then me. But actually, I'm in more liaison with the eating disorder nursing team than I am with my consultant colleagues about the mental health aspect of things.
Yeah, Thank you, James. And I mean, I guess when we're talking about, you know, evidence for going and knocking on doors about these roles, of course, within your own department, if you just audit your inpatient load and your outpatient load, you know, the evidence is there to support the idea that there should be lead roles within the department for mental health, because I think most, certainly surveys across the country in the last 2 years, the proportion of young people on paediatric wards at any one time with primary or secondary mental health problems is very significant compared to other chronic conditions where we've naturally always assumed that there's a lead within the department. So thank you for that, James. We've got another question. Where can we access training in assessing for common mental health issues as paediatricians? So again, I'll go to Emma in a minute, but for me, we've been doing work in the college on the Progress Plus curriculum, because actually this shouldn't be anything different from normal paediatric training. This should be absolutely embedded in paediatric training, which it is in the Progress Plus curriculum. And really the way in which we did that was just every time you see the word physical health, it also says mental health now in the Progress Plus curriculum. So whenever you're sort of doing case-based discussions, whenever you're doing, you know, any sort of clinic observed interaction, anything like that, we should be equally using mental health situations as we are physical health situations. And common mental health issues are in our general paediatric outpatients the whole time at the moment, around sleep, around parenting, around, you know, screen use, around diet, around it's all around us. So I don't think we need to be thinking you get separate training for common mental health issues. It's embedded in our paediatric training. It's there if you try and get it, and it's recognised going forward that it's going to be equal to physical health. What would you say, Emma? Would you agree with that?
Yeah, and I think we've tried to have mental health being the golden thread throughout the whole general paediatric curriculum in at the college, but if there's some sort of specific training that people want, you know, the PMHA webinars might give you access to something, the conferences, linking with your local PAMS teams, trying to join the PAMS registrar training days is very useful. ACAM is a really good Association of Child and Adolescent Mental Health is a very good association that does lots of training. HE website has got loads of stuff. MindEd has got lots of information about things. So, I mean, but, you know, common mental health problems, anxiety, low mood, self-harm, you know, these are things that, you know, we see all the time in the general paediatric clinic. And so it really should be embedded as part of the general paediatric training.
Great, thanks, Emma. So we've got a question that's come through, which I know, James, do you want to pick out, because there's so many coming through, and you said you were quite keen to take a question about nursing. Do you want to pick out that question and respond to it?
Yeah, I just spotted that one and thought it'd be worthwhile feeding back. Some of this funding that Karen's been talking about, that it is for senior nursing staff as well, to be taking on this leadership role. And I certainly know that Claire Tanner, who is one of our senior sisters who works in Barnstable Hospital, is their paediatric mental health liaison nurse. She's come from a peds nursing background and has moved into that, and she does an absolutely stunning job of leading the team there and changing the attitudes and changing the culture. And then I know that there's big movement nationally with that as well, and Catherine Curra is sort of driving a lot of that. I'll pop the names in the chat for you as well, but yes, I wouldn't be anywhere without the nursing support that I've had, and they're absolutely crucial in this, and crucial to bridging the support and training that ultimately is important that the paediatricians get it, but the people who are really dealing with the brunt of a lot of these complex admissions are the nursing staff, and they're the ones who need support and training the most, I think.
Yeah, thank you. I definitely second that. I mean, the other thing just to let everyone know is that RCN are part of all of these groups that I've talked about, us being representing RCPCH on, so they're always part of all of these work streams anyway. And also just a non-apologetic plug for the article that's coming out in Milestones magazine, the next edition, which is a joint article between myself, James, and actually Claire Tanner, the senior nurse up in Barnstable that James has just referred to. So it's actually only sort of 5 to 2 now, and I know for a lot of people they'll have joined quickly in their lunch hour, and I'm wondering whether we draw that to a close now so everybody's just got time to transition to their afternoon. We've had quite a few questions come through that are very specific, that we've thought are probably not necessarily of interest to everybody who's on the call today, but obviously to that person who's posted that question, we will look through it all and we will try and do a personalised answer to you as best we possibly can, and also make available some of the resources that we've or the various things that we've referenced throughout this. Yes, we'll make those available to anybody who asks. So just on behalf of myself and the Royal College, thank you very much, James and Emma, for joining us today and sharing your thoughts on this, and thank you very much to Kate, Zara and Vicky for their organisation of the webinar. It would be really nice to think that this is the start of what might be regular webinars for a networking group of paediatricians who all lead in mental health. So let's keep our fingers crossed and all look forward. Thank you very much for your time, everybody.
Thank you.
Bye-bye.
Bye-bye.